Okay. Hi, Dr. Erika. It's so good to see you.
It's even better to see you, Linda. You have no idea how happy I am to be with you.
Thank you. I appreciate that. I'm really appreciative of your time. I know how busy you are, so I want to ask you a lot of different questions today, other than some of the normal, typical hormonal stuff that people ask. But I know we'll probably circle around into some of that because everybody seems to have a lot of the same questions, and women are still confused. So hopefully we can
Right.
clear up some of that confusion today.
You do a great job of doing that. So I'm sure we'll do a great job together.
Thank you, thank you. But I think it's important to just to introduce you because people see you on social media and they know you talk a lot about hormone replacement therapy, and I think a lot of people are not really sure about your background. And I think I want to tell people that having known you and having lunch with you and talking to you a little bit personally and seeing you at the Academy, A4M, the American Academy of Anti-Aging, which is how I found you originally years ago. And but you were born in Romania
True.
and it said you grew up in Italy. Is that correct?
Right. In Rome.
Okay. So
How lucky is that, huh?
yeah, that's got to be pretty awesome. A lot of good
Pretty
food.
awesome. It was. It was great, but I couldn't appreciate it because I was too young. So I didn't know.
How old were you when you came back to the States?
I came back to the States in when I was 16. I
Okay.
graduated high school in Rome, but I graduated from an American high school.
Okay.
So it kind of takes away from, the luster of the Italian everything. But I didn't speak English when I first got there. And I learned English at this overseas school of Rome. And everybody was the kids of like the diplomats and the people who were working in Rome, the expats. And I was like, the Romanian immigrant, and I didn't really speak any language. So I did well in math.
Okay. Are you fluent in Italian?
Yeah, of course. But
Okay.
remember, but keep in mind, Romanian is a Romance language. So Romanian, Italian, Spanish, Portuguese, they're pretty much very similar. And
Okay.
so it was pretty easy to learn. So I
How
can't
many,
take too much credit for it.
how many languages do you speak?
Well, yeah, if you think that each one of them is like an individual language, which I'm not so sure they are, um, I would say five.
Okay.
I used to, I went to a Lutheran elementary school, German elementary school. So I spoke the first language after Romanian was German.
Wow.
And then when I learned English, which was when I was my teens, I forgot. I couldn't speak German anymore because they're so similar. And now I understand German, but I can't speak it.
That's that's
Isn't that
amazing.
funny?
How long that is. So tell us a little bit about, like, did you always know you wanted to be a doctor growing up? Like, tell us a little bit about like what 16, 17, 18-year-old, not doctor then, Erica was like.
Oh, you're so nice. You know what? Nobody asked me these
I know it's,
questions. I
it's
love it.
interesting. It's so
I
interesting.
love
Like, did you
it.
like, yeah, I always wanted to be a doctor, and I always, did you know what kind of medicine you wanted to practice, or maybe it's just something that came to you?
So my uncle, my mother's brother, was a very famous doctor in Romania. He
Okay.
was actually in the 60s the president of the International Tuberculosis Society, which was some big thing because everybody had tuberculosis in those days. So he wound up leaving Romania and moving to Italy, and that's how we wound up in Italy.
Gotcha.
And when I was 5, he took me, he had his own lab. He was a researcher too. He was a clinician and a researcher. And so when I was 5, he took me to his lab and I remember he had like these frogs that were live frogs that they were doing stuff with. And then he showed me stuff under the microscope. And I was just very take it up with that. And I thought I was like really amazing. And I thought, oh, this is something interesting. And then I never really liked anything else. I always liked more and more medicine. But the interesting thing that it always has to be very personal, right? The interesting thing is that my mother got sick, and I did a TEDx talk that I talked about it in it
Oh, okay, I didn't know
about
that.
it. Yeah, but this is interesting that my mother had lost her kidney. They had to take her kidney out because she had really bad pyelo, and with kidney infection. And in those days, they didn't have vascular sutures. So they would put a clamp to hold your artery and vein together after they took off the kidney. So they would leave the clamp sticking out of your body. That's interest more TMI maybe. But um, the thing is, they would leave it in for a week, and you could see the, the like the pulse going and the end of the clamp sitting there. And then after a week, they would take it out. So if you had sealed automatically, if your body had done the sealing, good. If not, you die. It was very, so it was a very interesting time because I was 9 at that point. So I think that that was a point in time when it sent me even more towards, obviously she survived, thank God. And it sent me even more towards wanting to be a healer. And I thought that being a doctor meant being a healer. So when I went to medical school, I found out that that was not the case. That being a healer had nothing to do with the conventional medical establishment. But in the meantime, I did internal medicine and critical care.
Okay.
And right. So I thought that that would give me what I was looking for. But I always wanted to do critical care. I liked acute care.
Mhm.
So that's how I got into critical care. But I won't ask you. You'll ask me your next question, so I don't jump ahead.
So, all right. So you went to medical school in New York. That's where you got
I
your.
went to Downstate, which is in
Okay.
Brooklyn, New York,
Okay.
State University of New York in Brooklyn,
And
and
then,
then Kings County Hospital, and I went to NYU College undergrad. So I was in New York my whole career, basically.
okay. And then, so then you were working in a trauma, you were working in a trauma center in Westchester Medical Center, right? Or New York City?
Yeah, so my first job out of training was to run the Westchester County Medical Center, Westchester Medical Center ER. Um, and I was like 28, and I was the first woman to ever run a trauma center.
What
And
year was that?
that was 1978,
Okay.
79.
Yeah,
And I did it for 5 years. And I loved it. I thought it was amazing, and it was really amazing. But I lacked. I felt it lacked, the connection with the patient, and I'm very into being connected and knowing people and caring about them. So I decided that I wanted to know more about the patients, and then I went into private practice and being board certified in internal medicine. I was like, okay, we'll do internal medicine, and I wound up doing it in Westchester, in
Okay.
Irvington. And
Okay.
I stayed there for about 10 years before I said, this is not the right thing. Because what I wanted to do was keep people healthy. Because what I learned in the emergency room that's interesting is that, we know American medicine is amazing. And I should say that before a book called Don't Let Your Doctor Kill You
I know.
comes out
Okay.
again. But the thing is that American acute care is the best in the world. The problem is there's no follow-up. There's no chronic care. There's nothing. And there's no prevention.
I was
So
gonna say.
I thought, well, let me figure this out because in the emergency room, I learned a couple of things. One of them, a couple of things. I'm sure I learned more than a couple of things, but two that actually
That stand out.
drove things home to me. One being that there were people that came in and we did everything wrong, everything wrong. We couldn't get it right. We couldn't figure out anything. And they walked out and they were fine. And then there were people that we did everything right and they died. So I
Mhm.
was like, what's going on here? Obviously, you could say there's a God, there is a universe, there's something bigger than us because, when you run out of time, you run out of time. But maybe, and this is where I started my idea with prevention, which in those days was like crazy because, the early 90s, nobody even knew what that was. I thought, well, maybe if I can help people, and now I'm going to use terms we use today, but we didn't use those terms in the 90s. We can optimize, make their lives better, help them. Wellness didn't exist as a term. Well, there was nothing. There was like nobody. There were like two or three people that were doing alternative medicine and giving supplements with no scientific backup, with nothing. And so I went to visit with them because there was nothing you could do. There was nowhere to read about it. And then I realized that they were what I would call quacks even today. And I thought, well, it's got to be conventional medicine. And this is where conventional medicine has to go in order to actually help people. Because the goal, maybe if you're in a conventional setting where all you want to do is sell drugs or do surgeries, by all means, knock yourself out. Hopefully, people will get smart enough not to follow that path
Right,
anymore, right? But the thing is, there are ways, and I always do. I grew up in Romania, so obviously I knew about diet. I mean,
right.
we were raised to eat clean food. I didn't even, the first time I saw food, bread in a bag, in a plastic bag, I was amazed. I was like, what is this? How could they keep the bread like this, right? So there was so many things, and every time I would say something about it, my conventional friends would be like, go
Look at you.
somewhere else. And I had no idea, where to go. So I basically learned on my own. And I called it prevention. And to this day, when I get on stage, you've seen me at A4M,
Mhm.
I will call it prevention because I feel like functional medicine, complementary medicine, any kind of longevity medicine, which is the big word today,
Or
right? It's like the catchword. But whatever you want to call it, to me, it's prevention. It's helping people extend their healthy life. And the way I look at life is a continuum of health with small interruptions when you're sick. And I want to make those interruptions as small as possible and make the rest of it where you're healthy and thriving and enjoying your life as long as possible. And I think everybody in that field, in our field now, is wants to do the same thing.
I feel like it's definitely coming around.
Yes, it
But
is.
there's still outliers. Like when we were talking before I pressed record about doctors, and we'll talk about this too before we move forward. But
Hmm.
doctors still telling my clients and even women that I talk to, and I'm like,
Sure.
talk to your doctor, maybe do these labs and talk about this and that, and they come back and like, doctor won't do the labs. Doctor said no. Doctor said it's not. Lots of different reasons. So even there's still even with every you turn on social media and you're kind of bombarded with all the gurus, right? I could list the name of all of them, right? But
Yeah, I'm sure.
still you'll go to your local doctor and say, hey, I'm feeling anxious, I'm depressed. Instead of them saying, well, how old are you, this could be happening, you get passed a prescription for some kind of antidepressant
Depressant, of
or
course.
anxiety or whatever, which isn't going to do anything. You're still going to feel crappy, and now you're taking a
Right.
pharmaceutical that's hard to get off of once you start taking it. So
Well, they're the most addictive medications there
mhm,
are the antidepressants, and they're also the number one medications prescribed, all those SSRIs and all that. They're really horrible for us. And, I was at a lecture, and a psychopharmacologist was giving a talk, and I asked him, how do you get these patients off of them?
yeah,
And because I had read all the stuff there was to read, and they're so addictive, it takes me a year to get somebody off of them
I
because I
believe
don't want them to ever be on them again. And he was like, who's talking about them getting off of them? So I'm like, well, they're not exactly missing Zoloft. They're not
right.
exactly missing, Prozac. They're not missing Wellbutrin. They're missing the feel good hormones, right? They're missing serotonin. They're missing dopamine. Why? What are they eating? How are they sleeping? What about exercise? I mean, what you do every morning, I love it. Start the morning on the treadmill and start
Yeah,
moving. Bring the blood there. Don't guzzle down that coffee.
yeah.
You don't
It's
need,
amazing. On the mornings I don't do that, it's like
yeah.
because I try to take a couple of rest days, where I can just kind of sleep in and get
Thank
up.
God. Thank God
Yeah,
you do.
I do, but it's always I'm a little groggy. It takes me a little while to come to, but when I start moving around, the blood flow, my brain turns
Of
on,
course.
and then you feel so like I can attack this day, like whatever's bugging
Yes.
me, I can deal with.
Right.
So
I'm with you 100%.
yeah,
100%. I start my day, first of all, before I open my eyes, I do this gratitude thing where I say, I'm grateful I woke up to see another day.
Yep.
And that I'm grateful for, like Linda today, like different, my dogs, my husband, whoever, right?
Right.
My kids,
Yeah.
the people I work with. I mean, there's an infinite number of things to be grateful for. And then I open my eyes and then I drink a glass of water and then I brush my teeth and whatever else. And then I work out. And I work
Exactly.
out for half an hour. It's not even like big things. I'm not doing weights every morning, I do it like to start, like you said, your blood moving, you feel better. And then once you feel better, an hour and a half later, by all means, you want coffee? Fine. I don't drink coffee anymore.
Yeah.
I stopped, but I'll drink a glass of tea. But I'll
Yeah.
have a smoothie before I do that, actually. Um,
So,
yeah, which is fine. I think it's a matter of like really creating a consistent plan for yourself that works, that you see the results of.
exactly. Exactly. So, all right. So let's go back a little bit again. So you're running an internal medicine practice. How do you go from that? When did you get into the hormone space? Like, because I know from talking to you, at events and offline and just knowing you that you were doing this back when people were like, it's black magic, it's voodoo science, it's, don't do, I mean, people
I
still,
did it before that,
yeah,
I started in 1996.
okay. And it's,
That's when I started. So then it wasn't bad because the Women's Health Initiative
right,
had started in 1992. The proof that they were looking for Provera and Premarin was to be like the eternal youth, which they probably would have proven it had they not been so scared to tell the truth,
right,
because it was money that the government took from Wyeth Pharmaceutical and Upjohn to conduct the studies in the different locations and university centers, right? And they gave them obviously the free Premarin, the free Provera. It's fine. There was not, I don't know. I think it was probably something to do with the amount of money that the government took and presented the study as a government study rather than a pharma sponsored study, which nobody else would have the money but pharma anyway. So
right,
I don't see the surprise. Well, anyway, 5 years into that study, something didn't look right. So they got so scared that the truth would come out about where the money came from that they busted the study in 2002 in July. And the OBGYNs took 7 million women off hormones, which is obscene. It's horrific. And to this day, they're going to lie about it. They're going to tell you that the OBGYNs are always wanted to give hormones. It's not true. To this day, like you said and I said before, people are still coming in from doctors who will say hormones are bad for you. They'll cause cancer. They will cause blood clots. They'll give you strokes. Well, that's not true. The science is there. I was lecturing at Harvard in 2008 and 2007 and 8, and the chairman of the Department of OBGYN stopped the department people, the doctors that were working in the department, from asking me questions because I had too much science. And he was like, we don't want to discuss that so much. So to this day,
mhm,
they're still, now they're jumping on the bandwagon, and thank
right,
God for women's sake that,
yeah,
but the truth is, if you don't know something, say, I don't know it, but
right,
don't poo-poo it. And so I dealt with the poo-pooing part for many years. So in 1996, one of my patients had come in to me and had asked me to write a prescription for what we now know as bioidentical hormones. They were called natural hormones in those days, as in estradiol, progesterone, testosterone, and to send it to some compounding pharmacy in California. Now, the funny thing is, I didn't even know what a compounding pharmacy was. There I am, a conventional doctor, having run a major trauma center. I've never heard of compounding pharmacies. And I say, well, what is it? I mean, I recognize the names of the hormones, but I didn't know what to do with them. And she said, oh, don't worry. I feel really great with it. I was prescribing Premarin and Provera
okay,
to women that were menopausal. And I was I was way before menopause in those days. I was like, well, whatever. I'll prescribe it. So I didn't know what menopause was about, and nobody talked about it. So anyway, so I wrote the script for her. She was doing great. And then I think that was maybe 95, because in 96, I went into menopause for some obscure reason. It was like some emotional trauma. And what happened was that I started taking Premarin and Prempro, and I felt horrible. I started bleeding like a stuck pig. It was really bad. My mood, it was like I had an alien inside of me.
Mhm.
I couldn't believe, like I'm sure you know what I'm talking about. Like
Yeah.
I was like, who is this? And I'm a pretty even keeled person. So I was like, okay, this is not gonna go. So I remembered the patient and I called her and I said to her, listen, remember, are you still using that stuff? She said, yeah, and I love it. So I said, okay. So can I had it in her chart. So I wrote the script, because you used to write scripts in those days. And I sent it. And $350, $400 later, I received this huge box of stuff. It was powders, it was creams, it was pills, it was like you name it, and with a recipe of what I should do. And I took out my notebook and I started following the directions. Some of the stuff you had to refrigerate, some,
Okay.
I mean, I can't even tell you how complicated it was. And the funny thing was that within a week, I was back to myself. So I called the guy with this compounding pharmacy, and thanks to him, I will forever be grateful to him, because he made me who I am today and brought the whole, hormone thing to where we are really. Because he said to me, uh, he gave me the science, because I had asked him for the science, because there was no internet in those days, and he had given me the science, so I had read all about it before. But this time I said to him, "Listen, I have a lot of patients who would probably benefit, but
Yeah.
350, $400 in 1996 was serious money." So I said, "Is there any way we can get some discount?" And he said, "I don't need you or your patients. So goodbye."
Oh, wow.
Yeah, but see, he created what happened next, because by pushing me away, I had to find a local
Okay.
compounding pharmacy. So I went around the local pharmacies and I found a compounding pharmacy in Thornwood,
Okay.
New York, and Westchester. And then I spent the following 3 years pretty much working on, his laptop with the owner, and working with my patients and with me to put together something that actually made sense, that was easier to use, because I mean, you need
Yeah.
something user friendly. So I created the estradiol, the progesterone, the testosterone, and created the protocols to go with it. And this is how it all started. So I obviously loved it. My patients loved it. And then
Yeah.
it was wonderful. But then it was wonderful until 2002. And I published my first book on hormones, which was The Hormone Solution.
Right.
And that, thank you. Oh my God,
It's
you
a
took
great
care.
book. It's my
Yep.
Bible.
Oh, thank you. I love you. Thank you. And The Hormone Solution came out in April of 2002. You know how, like I always say, we're vehicles,
Yeah.
because things happen. I have no idea, I mean, why they chose me to do it, but they did. And the book comes out in April of 2002, and in July of 2002, the Women's Health Initiative goes bust. It becomes a big mess, and I'm the only one who has this book out about hormones. It's #2 on Amazon, and I'm on my honeymoon in Italy, of course.
And your phone's ringing off the hook, right?
Right. And all of a sudden, I'm like, all I do is talk about hormones. And initially, it was great. But then I was like screaming in the dark alone, because everybody pulled back. They were all scared. And I was like,
Okay.
we have the science. I have all these patients who are doing great. I could tell you today, 30 years later almost, right? Um, I mean, I have patients who've been with me for 30 years.
Yeah.
There's no cancer. There's no heart disease. There's no Alzheimer's. There are no broken bones. Now, I'm
Mhm.
sure it's not just from the hormones. It's also because they exercise, they
Right.
do
Right.
weightlifting, they eat right, they sleep. They don't drink. I mean, there are a lot of good things that they put together, but all, and they do the right supplements, peptides, everything else we do. But the
Right.
thing is that without the first layer, which is the hormones, you can't get off the couch.
I know.
And if you don't give someone the right hormones and the right combinations, and you put them all together, it doesn't work. So I think anything with hormones works better than nothing. Because when you have hormones in you, you feel great. You look wonderful,
Absolutely.
fertile, you have a
Yeah.
brain, you have
Yeah.
passion, you have everything going for you. But when your hormones start heading south, everything else heads south. So I think that's, I always stuck with it and I was right. And now that I was right, I feel kind of redeemed, but I also feel like now everybody should be on hormones, which they should have been all along.
Yes.
But also, there are too many out there who really don't know what they're talking about that are, and I see new patients all the time. And the problem is that I see a lot of people that are getting poor care, like everything else, poor quality care, because people are not well trained. So
Right.
you should actually make sure that you work with doctors and providers who actually know what they're talking about and that they have the right experience. And you were saying about A4M, not plug the A4M. I mean, I am on permanent faculty there, and we train everybody about, how to do it right, how to give peptides right, how, and we do it as a 360, the way you do it.
Right.
The way you coach your people with your diet, with exercise, with sleep, with life experience, with everything you're doing, it works. And the hormones are really the foundation.
It really does work. Is there a woman, are there any women that would not be eligible for to do hormone replacement therapy, like someone that has a pre-existing some kind of condition, or can every woman use hormones?
That's a very good question. If you ask me,
Yeah.
from where I sit 30 years later, I think everybody can use hormones. There are times when you're better off not using them, like if
Mhm.
you have acute cancer that's being
Right.
treated,
Okay.
take a break, but go back to them afterwards because the oncologist is going to say, "Oh, you don't want the hormones."
Right.
And you have estrogen positive breast cancer or progesterone positive breast cancer. Well, that doesn't mean that that's what caused your cancer. That
Right.
may very well mean that you were lacking it, or maybe the ratios were wrong. So that's one time that people take people off hormones. Now, there is a time that people are taking them off hormones, which are really bad. And that is pre and post surg pre-surgical because
Yeah.
the conventional world, surgery, before surgery, they take you off everything.
Right.
Supplements, hormones, peptides, whatever. This is the thing. That is an outdated and totally erroneous way of doing things. Now, yeah, you don't want to take your blood thinners, so
Right.
you won't take omega, you don't
Right.
have to take vitamin D, but the rest of it, taking the hormones is really important. And the reason they tell you to go off hormones is because they're thinking birth control pills and they
Okay.
don't know, or they think Provera, so
Mhm.
which are progestins, right? The thing
Right.
is, they don't know the difference. They don't realize that various hormones behave differently, that there is no such thing as class effect. So by class, I mean, all estrogens don't behave the same. All progestogens don't behave the same. It sounds very scientific, and I don't mean to sound like too blah, like that. But the thing is that estradiol, as an estrogen of youth, that is the estrogen our body makes, will not cause you to get blood clots or get any
Okay.
problems that surgery will create that will enhance, make surgery worse. Progesterone, as in the progesterone we make after we ovulate every month,
Right.
is also not going to cause any problems. Testosterone will not increase the risk of blood clots.
Right.
So if you understand that, and
Mhm.
talking to a surgeon is like the same as talking to OBGYN who
Yeah.
still thinks that hormones cause cancer. They're not going to listen to you. So talk to your doctor who knows about it. Talk to your provider who understands hormones. And unless you're on birth control pills or Provera, which nobody's on Provera that I know of, if you think about IVF, that's a perfect example, right?
Yeah.
IVF, they use hormones, but
Right.
they use bioidentical hormones. They use estradiol and they use progesterone. They
Okay.
don't use any of the synthetic, but they're all synthetic because they're made in a lab, but they're
Right.
made to look exactly the same. So you want something that looks exactly the same. And if you look at IVF, where they use a ton of hormones, they're not getting clots, they're not getting
Right. That's a
problems,
good point.
right? So if you
Mhm.
think that way, they're using the right hormones.
And it's interesting that you bring that up because I have two I have two clients, and one's in her early 60s, and she had some blood clots and took care of it. She is on blood thinners, but her doctors tell her, no how, no way can you do hormones because of the clots. And I know she would totally benefit from getting on some HRT because, she'll mimic some of the things like either having a hard time losing weight or just the joints don't feel good, the muscles don't feel great. It's a little fatigue. And then I have another client friend who had had three stents put in her heart last year. She's on blood thinners. She is on HRT, but her cardiologist does not like the fact that she's taking Armour thyroid and she's using testosterone. He really wants her to stop, but she said, I'm
What
not.
does he know about it?
So
See, this is the thing.
yeah,
What you're saying is so important because when they say, "Oh, the cardiologist doesn't like them to do that," or the OB doesn't like her, or the surgeon doesn't like, what do they know about hormones? Is my
right.
question.
What are they
Because
basing
I
it on?
don't get involved to say what kind of incision they should make,
Right.
or how they should do the hip replacement, or I don't get involved in that because I don't know anything about that. But why do they get involved in what we do, which is hormones? So hormones are great. I mean, if you have hormones, and I feel badly for your patient for your client, because the problem is that they're not benefiting enough from what you're bringing to the table. And
Right.
I think what you're bringing to the table is so valuable. It literally is priceless.
Thank
And
you.
it's true. And the thing is that they're not benefiting enough because they don't have this, the substrates. They don't have the foundation. And it's a problem because you want them to find providers that will give them the foundation and then send them to you and you can actually take care of them by the hand and give them everything else and then they can really love their lives.
Absolutely. My one friend that had the stents, she's on HRT and she's like, she feels great. She's like, I'm doing what I want to do.
Sure.
And then my other client, I know she's nervous, and I understand that because
Of course.
blood clots are scary, and they've said that deep vein thrombosis, it causes all these different things. Estrogen's a problem, but I always encourage her to. I'm like, hey, talk to a Dr. Erika or talk to a doctor if you have,
Dr. Kristen.
yeah,
Dr.
someone.
Kristen, right?
Yeah, exactly. That can at least give you the facts, and then you can make a decision. You don't have to do
Right.
anything, but at least maybe have the conversation, and then you can
Right.
make a decision. But it's just unfortunate that people are so scared. And I try to use myself as an example too. And I'm like, listen, I've been doing this for a couple of years, and I feel great. I had fatigue, I had joint aches, I had anxiety. I didn't have depression, but
I
I was
can't imagine. I
wicked
can't
anxiety.
imagine you.
It was like, and I wish I had known this stuff back in my late 40s because I look back now, I'm 57, but I look back like 10 years ago and I think, God, if I had known then what I knew now, like my life probably would have taken a different trajectory because I was reacting to so many things and I was so
Sure.
anxious. It was kind of weird, but now I know why.
Yeah. Well, now you know why, and you're doing the right thing anyway.
Yes.
So I
Yes.
wouldn't worry about that. But I
Yes.
think that that's so important that to know that it's okay. And that's like, and don't let your doctor kill you. And, it's, I write about this a lot because I see it every day. And, I always think, oh, I should have added this to the book. And then the new version has
Yeah.
COVID and
Okay. That'd
um,
be great.
Yeah, the COVID, and it also has AI in it and what that's going to do. Actually, I think I'm very pro AI from the standpoint of conventional medicine protocols because they can take that away and let the doctors learn how to take
Right.
care of patients. Maybe that would be a novel idea because now conventional medicine is all about fear
Hmm.
and getting people so scared that they're missing something, they miss out on their lives, and they're constantly looking. There are tests and tests and tests,
I
and
know.
it just ruins your life. You're
It does.
missing out on your life.
It does, because they'll say, my hip hurts, my shoulder, the frozen
Oh God.
shoulder, all the
Yeah.
stuff. And then so they run to an orthopedist, and then they're going somewhere else for something else, and then they're going to get their prescription for something. And it's like, no, let's. I always tell them, like, you should look at your hormones because I bet that would answer a lot of questions. Seriously, like, you
Yeah.
don't need a statin, you don't need a this. You have high cholesterol now. Well, no shit, sorry, but
Of course, you're right, but you're right. But
you
you're
have no
right.
estrogen, so you're not
Yeah.
making HDL the way you used to. So of
And
course.
by the way, just because, and this whole thing with the statins, which I find totally
Yeah, I
repulsive.
just reposted something from your Instagram about if your doctor tells you you have high cholesterol, throw the test.
Yeah, yeah, because you need a cholesterol of 240 to have a brain and to make
Yeah,
hormones. Hormones are
hormones.
made from cholesterol, right? But the thing is that what exactly are you thinking, focusing on things that have not, and being scared of a number? I mean, because they scared the living daylights out of you
Yeah,
that, oh my God, my cholesterol is 220. What does that mean? It means nothing. And then when you said about LDL, the thing is that unless you know that it's oxidized LDL, it doesn't mean anything either. So what are we talking about? And there are a lot of people, and there are a lot of people on Instagram, and we
yeah,
see it all the time, who are experts who tell you exactly what you should do. And from where I sit, I'm not so sure that they know what you should do because I don't know how much experience they really have beyond what they're being fed by whoever's sponsoring them. And
I
nobody's
know.
sponsoring us, so that's good.
So I want to ask you a question too about a question I get a lot from women, and everybody complains about the soft belly midsection thing that happens in midlife, right? So you know what I'm talking
Yeah,
about. Your abdominal
yeah.
area gets a little soft, a little squishy. They put their,
Yes.
they put their pants on, and that stuff kind of hangs over the waistband. And
Horrible.
can I
We
tell you,
hate it.
every woman, every client, female woman I talk to that works with me, whatever, it is always like one of the biggest pain points that when they send me their photos, their before
Yeah, of
photos, it's like, okay, they're like, I know exactly what they're going to say. So
course.
can you talk about why that happens? Why that physiological change happens when our hormones start to drop off or we get into midlife? Like, why does that area get fluffy?
Well, I don't think we know for real what
Okay.
the truth is. We don't know. But we know that as your hormones leave you, your skin tightness goes away.
Right.
And we also know that that's a very good place where cortisol deposits fat, and it likes to. And then most women have had children, so that's an even better location to put some more fat in there. And the hormone disappearance and the cortisol bath that we live in because we're stressed to the hilt from our lives and we don't know how to stop it. Those are the contributors. And the other thing I tell you is that the more you focus on it and the more you worry about it, the more likely you are to get it, that you
Mhm.
can't get rid of it. Now, everybody is on tirzepatide and semaglutide, so we're getting rid of them. And, because that's really where most women's like fat deposits
Yeah.
go, as I said, from the hormone changes primarily, but we don't really know why over there. There's some women who'll get it on the hips,
Yep.
more
On the
likely, right? Yeah, I'm
thighs.
sure. There's some who get them on the inner thighs, you
Hmm.
know. So I think it's genetics, it's obviously the issues with the hormone changes, but it's primarily stress. It's a stress reaction. And I think that, exercise will tighten it, but it's not going to make it go away.
Right.
Diet will help you lose the weight. So the less weight you have, the more likely you are to have a flat stomach.
Right.
But that's not me encouraging you to get skinny. That's
No,
not.
no, no. But I would agree with you that in my experience of working with women, and most women are not eating properly, and
I know.
they're either skipping meals, or then they overeat, or a lot of them are still drinking a lot of wine and stuff at night to calm
Right.
down, go to sleep and take the
Yep.
edge off, or have just gotten into that habit of having a drink at night or drinking on the
Yep.
weekends. And it's a tough thing, and I get a lot of furry eyeballs when I ask them to like stop drinking or cut it back. Like, I've had women not work with me because they're like, "You're going to tell me I
Sure.
can't drink on the weekends?" And I'm like, "Well, I'm not going to. I mean, you're an adult. I can't tell you what to do, but I will say if you cut back, if you can cut back at least to start, and then maybe we work towards cutting it out." But I've had
Right.
people like just ghost me because they're like they don't like that answer. But you know, lifestyle, eating right, and eating correctly throughout the day and exercising. And I tell them, like, we can make a big change in how you look and your body composition. It's going to take time. It's not going to happen in maybe in 3 months. It might take a year, but I'm like, you can make it look a lot better. I can't tell you you're going to look like you're 35 again, but a good plastic surgeon could probably do that. But you,
No, because they'll
we
leave a
can, but you can,
scar. But then they leave a
yeah,
scar. Do
no,
you
I
want
know,
a
but
scar?
you know,
No.
but they can make changes by changing their lifestyle, cutting out the alcohol, sleeping intake, getting exercise, and just doing things differently. But I think the hardest part of my job is getting women to really adopt that lifestyle. But I do get them, and they do it, and then it's amazing because they're like, "Oh my
Hmm.
God, I feel so much better." And then if I can get them to you, or if they have a doctor that will support them in hormone therapy, it's like night and day.
Of course. And you know what the other thing is? So, I was on Good Day New York when the Surgeon General came up with the, connection between 7 cancers and alcohol use, and how the General said, well, no alcohol.
Right.
Okay. In a world that we live in
Yes.
where, liquor stores were essential business during COVID, but gyms were closed, I don't know how you're gonna say
Right.
that and expect people to turn around and go to the gym and
Right.
stop drinking. I mean, it's kind of unreasonable. But I was on the Today Show, and the Good Day New York about that. I was on the Today Show about hormones, perimenopause, right? That worked. Anyway, but I went out to dinner that day with the host of the show, and we were at this restaurant in the city, and I looked around, and I mean, this is a show that's really well watched in the city,
Right.
right? Every table had alcohol on it.
Yeah.
Every single table. So I thought, "Well, how do you expect to change that? How?" Because I always say to patients, when I was about 40, I stopped drinking alcohol completely.
Same. I was about 42.
Yeah, yeah. So, you know what? It changed my life. It totally changed my life. It wasn't like I was a big drinker before because my body didn't like it. So I'd throw up as soon as I have 2 glasses of wine. So it was like gone. But I stopped. So my husband called me the Temperance Society and said, oh, anyway. And then I said, listen, do whatever you want. I will never tell a patient stop drinking but
Right.
if you're going to ask me, I'm going to tell you,
Right.
if I get your hormones in balance, if you're seeing them and taking care of everything else, if they're sleeping, they're drinking enough water, they're exercising, and there's still something missing, look at the alcohol or the amount of alcohol.
Mhm.
We just
Yeah.
finished summer, so everybody falls off the wagon in the summer because this is part of the culture
Right.
we're in. So I'm not judgmental of that.
Right.
I'm more about raising awareness and saying, if you can see a connection and you can make a connection, then maybe you can try to alter the amount, the frequency.
Right.
Have a glass of water, then a glass of whatever you're drinking, then a glass of water. See how you feel.
Right.
Because it's like the Diet Coke thing, the commercial thing, like you drink a Coke and then 2 hours later you see how you feel, and you
Right.
drink a glass of water and 2 hours later you see how you feel. Well, it's the same thing with alcohol. Pay attention and raise awareness because you probably will decide at some point
that you don't
that you
need it.
want to take care of yourself, right? You
I
want to feel
know.
better.
Well, I mean, it causes, vasomotor symptoms. It'll give you hot flashes. It doesn't help. It really doesn't help you sleep. And I do the same
Oh,
thing. I never judge either, but I will just say, listen, like you, if we can cut back, maybe it's a drink on Friday night and a drink on Saturday night, and then you're kind of done. And maybe you switch over to Pellegrino or something like
right.
that. And then maybe during the week, we kind of keep it clean so that, you can see how you feel. And
Anything.
many times women will, they'll do that, but sometimes they're like, yeah, I don't really need it. And then like, you know what, I feel so much better anyways without it. So,
Yeah.
but you're right, it is just raising the awareness. And
I think it's about raising awareness. And I think, do you know what's interesting? I get a lot of young patients because people are much more into health and wellness now, right? So I have a lot of 20-year-olds, early 30s. Alcohol is not an issue. They will not drink.
yeah,
It's unbelievable. So it's the next
I
generation,
know.
and you don't have to have that conversation. And they're all at the gym doing, I mean, I was at the gym this morning in Norwalk, right? And all these 18-year-olds, 20-year-olds lifting 400 pounds, 500 pounds. And I'm like, whoa, good for them. And they're
Yeah,
not just like, big bodybuilders, but they're doing it because they feel good.
I
And
know.
it's a different mentality. So the next generation, the next two generations coming in we're going to see very big differences.
Yeah, it'll be great because I mean, lifting weights is really one of the best ways to release
Oh my God, I
anxiety and
love it.
depression
I
and stress and cortisol and raise oxytocin and
love
uh,
it.
but before I let you go, because I know you
But lifting weights is my favorite
I
pastime.
know. Me
I
too.
can't, I love it. Yeah,
I'll always be a musclehead. I can't help it.
I love it. Are you kidding? I wish I was a musclehead. One time, I didn't tell you, one time I was on the beach. Did I tell you? I don't know. Maybe
I
I
don't
did.
think so.
Yeah, I was on the beach in someplace and I had little kids and I was wearing a bathing suit and this guy comes over and said, "Oh, you're a bodybuilder?" I wasn't a bodybuilder, but I was working out because I
Good
always
genetics.
have and I'm built that way, right?
Yep.
And I was like, "Oh, that was like the best compliment I ever."
Hopefully he looked good too.
Yeah, I don't remember him, so he didn't really impress me
No, but
much.
that's a nice compliment. That's a good
It
compliment.
was, I took it as a great compliment,
Yeah.
but who knows because the kids were young. So that's like 30 years ago,
I
who knows?
mean, the more muscle you have, the better you are. Your metabolism's good. You can even if you want to cheat
Hallelujah.
periodically, you just burn it off. It's like
I'm with you a
so.
100%. A
I
hundred
I work
percent.
out for the I work out for the food. That's what I say.
Oh yeah, that's good. I mean, listen, I eat the food anyway, but I work out because I feel good.
Yeah,
Because I walk around and I feel great. Nothing in my body hurts. Nothing. Yeah, you
I
could
know.
say, yeah, of course I do the hormones. I sleep. Eat well. I do everything. I take the peptides. I do everything else, but I feel great.
Yeah, and you look fabulous. So
Thanks. Well,
I
that's
don't know.
my
Do you
fan club.
do you want do you want to share your age or no? I know you
I'm
have.
75 years
I
old.
know, which is freaking amazing. That's why I want you to say it because you don't look it. You look like you're 55 years
I
old.
know. Like here, we can show them my muscle. I mean, look at your muscle. When you show me yours, oh my God, what did we do with that picture?
I
At the
have it
gym?
still. That yeah,
Okay.
that's a great picture. I love that picture.
You should post that picture more often. I love
Yeah,
that picture.
I'll have to repost it
I
when.
think I have more muscle this year. I think we'll do another one. We should
Yeah,
do it yearly. We
we'll do
should do
one
it
in
yearly.
Scottsdale. I can't wait to get out there.
Yeah,
So,
we'll do it. Yeah, let's do
but
it.
before you go, so you're re-releasing "Don't Let Your Doctor Kill You."
Yes,
And
it's
that's
being
coming out
released like
next month or November.
October.
Okay.
October. October.
And so, if people want to pre-order, is there a place to do that or?
I think Amazon will have it posted soon, but like on
Okay.
Amazon, it'll be on Amazon.
Okay.
If you go and order it now, you might get the old Don't Let Your Doctor
I
Kill
looked
You.
today and it didn't have a pre-order yet, so I went on
Okay,
today.
so yeah, so it still has the old one. So don't order it yet.
Okay.
Remind yourself, put a reminder in a month from now to order it.
Okay.
And Amazon will have it, and then there'll be a lot of places where we'll
And
be
this is a great one too for people that just really want to understand also about their hormonal health and get some really good answers.
Yeah, that's the re-release of the one that was number two on Amazon in 2002. And
Okay.
that's a lot more comprehensive than the one that was number two, so it did fine. So
So,
people
but yeah,
want to.
I'll put all that when I put this on YouTube and send you. I'll have everything in the text so people can find everything, the book,
Beautiful.
and
I
hopefully
can
we'll be
thank.
doing a book signing in Fairfield County with you in June.
Yes, of course. Happy.
And
Happy.
thank you so much for your time. You're the best,
Thank
really.
you. Oh,
You are
Linda,
the
you're the
host.
best. Thank you. Thank you. That was from Thailand.
Thank you so much, and I look forward
Thank
to seeing you again very soon.
I'll see you soon. Very
Yeah.
soon.
Absolutely.
Bye.